Aloha, and welcome to this presentation of the Vegan Society of Hawaii. We are so thrilled and honored today to welcome a physician who has been a true pioneer in modern medicine, Caldwell B. Esselstyn, Jr. His pioneering research is summarized in his best-selling Prevent and Reverse Heart Disease. Dr. Esselstyn's talk today is entitled The Nutritional Reversal of Cardiovascular Disease, Fact or Fiction? Aloha, Dr. Esselstyn.
What I want to speak about today, and I thank you for the kind invitation to talk about my research and clinical strategies for the leading killer of women and men in Western civilization, which is coronary artery heart disease. Now, the interesting thing is that if you were to be a cardiac surgeon and you decided to hang out your shingle in Okinawa, rural China, the Papua Highlanders, Central Africa, the Tarahumara Indians, you can forget it. You're not going to have any surgery. Why? They thrive on whole food, plant-based nutrition without oil. This slide that you see now is the oldest one in my presentation from 1968, which was when I was leaving Vietnam, having spent a year there as a combat surgeon. And the reason I showed this slide is to remind me to share with the audience that when we autopsy our GIs in combat in Korea, and you look at the coronary arteries, roughly 80% of this average 20-year-old group has gross evidence of coronary artery disease at that young age that you can see without a microscope. Not enough for their cardiac events yet, but there at that young age, we see that disease beginning to get a toehold. So that's actually, that same study was then repeated 45 years later, this time looking at young women and men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. And now the disease is ubiquitous. Everybody. Really, it's most impressive that by the time that group gets to be in their late 40s and early 50s, we begin to see this tsunami of cardiovascular disease in this Western civilization, United States and American population. All right. However, we had a chance to absolutely get it right back in World War II, when the Axis powers of Germany overran the Low Countries of Holland and Belgium. Characteristically, they took away their livestock for their troops. So their cattle, their sheep, their goats, their pigs, their chickens, their turkeys were gone. That meant that Holland, Belgium, and Denmark and Norway, which were occupied, were now thriving on whole food, plant-based nutrition. And it was interesting that Drs. Strom and Janssen, reporting in 1951 in England's leading medical journal, The Lancet, they were able to look at the deaths from heart attack and stroke in Norway during this time period. So let's do this together. Let's look on the left-hand side of this slide. And we see in 1927 in Norway, heart attack deaths and deaths from stroke were increasing. 1930, going up. 1935, going up. 1939, in come the Germans. Down go the deaths from heart attack and stroke. Who knew? These Germans were these great public health educators. But look what happens. 1945, with the cessation of hostilities in the European theater and the death of Adolf Hitler, back comes the meat, back comes the dairy, back come the strokes, back come the heart attacks. However, we just didn't get it. Now here you have two arteries. The normal one is on the left, and the one that is thoroughly diseased is on the right. And you're probably saying to yourself, with that artery on the right, when that small remaining opening closes off, there'll be a heart attack. Well, interestingly enough, only about 10% of heart attacks occur from something this severe. Yes, you're going to have maybe some chest pain, angina, shortness of breath, but we're going to show you in just a short bit of time here how 90% of heart attacks occur. On the left, I want you to notice in the normal artery, if you look at the inside, there's a tiny little dark line. That dark line, single layer of cells are the endothelial cells, which are so important, and we're going to be discussing those more in depth. Now, what usually happens in the West, when you're eating a cheeseburger, a pizza, a milkshake, what happens is that suddenly everything begins to get sticky, sticky, sticky. Your endothelial cells get sticky. Your white cells get sticky. Your platelets get sticky. Your LDL cholesterol gets sticky. And we're going to come back to this in a moment. But here is a slide from Peter Libby from Harvard. And the blue area is where the blood is flowing. And what separates the blue area from the artery wall below are that single layer of purple endothelial cells that go from left to right. Well, let's start again on this slide in the upper left, and you will see there the LDL cholesterol. And the LDL cholesterol now has been oxidized by these free radicals that you've been eating with this that we discussed. The LDL cholesterol is going to migrate through a crack, a fissure, or an opening in the endothelial wall. It will migrate through now into the subendothelial space. There it is further oxidized, and from here on, Peter Libby from Harvard paints his LDL cholesterol molecules yellow to indicate that it is now a small, hard, dense, oxidized LDL cholesterol. Now, the subendothelial space does not like this, calls upon our SWAT team, these blue cells, these macrophages, that also will now migrate through a crack, a fissure, an opening, and they themselves now are in the subendothelial space, and their task is to sort of gobble up all these small, hard, dense, yellow LDL cholesterol molecules. And if we go from left to right, when we get over to the right, where the macrophage or the SWAT team member is now completely filled with LDL cholesterol, it now is going to have its name changed, as we so often do in medicine. It's now called the foam cell. And the foam cell is truly the Darth Vader of this sequence of events. The foam cell manufactures these nasty metalloproteinases, stromelicin, elastase, collagenase, myeloperoxidase. What do? What they do that is so bad is they progressively begin, as we look at the figure on the left on this slide, you'll see in the upper portion of the plaque, it's gotten so thin that the sheer force of blood racing over that thinned out cap over the plaque makes a small tear. And what happens is within a matter of minutes, as we go from the figure on the left to the middle figure, the area where the tear has occurred, a clot has formed because the material inside the plaque is highly thrombogenic as it oozes out into the flowing blood. In a matter of further minutes, we now go to the figure on the right because the flowing blood is now actually further activated this clot that we saw in the middle figure, which was self-propagating until it gets over to the right. Now what happens? The clot is completely obstructing and blocking the vessel. So all the downstream heart muscle at this point is immediately deprived of all oxygen and nutrients. It starts to die, and that is 90% of your heart attacks. Now, if I do my job correctly today, hopefully all of you who are listening and maybe your friends and relatives will learn how to make themselves heart attack proof. And you make yourself heart attack proof not with a lot of drugs, not with stents, not with bypass surgery. You make yourself heart attack proof by changing your biochemistry. How are you going to do that? You're going to start eating whole food, plant-based nutrition. When that is accomplished and you're eating whole food, plant-based nutrition, your biochemistry changed so that that entire cascade of events that I just described for you will not occur. You're not going to get oxidation of your LDL cholesterol. It is not going to migrate into the subendothelial space. You will not see the formation of the foam cell. The cap over the plaque will become thicker and thicker. And as you thicken your cap, you strengthen it. And when you strengthen the cap over the plaque, it cannot rupture. When it cannot rupture, you made yourself heart attack proof. We think that is going to take probably at least 3 weeks, and I'll try to share that with you later. You can forget this X-ray in this slide, but I want you to concentrate on the artist drawing of this artery, which is now half filled with plaque, and the other half is still open. And you can see in the half that's still open, it is lined with these endothelial cells. It's interesting that historically, up until 1980, we used to think of the endothelial cell as a cute little red brick that was lining these wonderful pipes of ours, our arteries. But that all changed in 1980 when Dr. Furchtgott, working in his laboratory in Brooklyn, was taking the largest blood vessel, the aorta, in the rat, and he would make this sort of spiral staircase elliptical cut on it right through the endothelium. Then he would immerse it in a bath of saline, and it would constrict. However, one day, he said, no cut, no injury to the endothelial cell. He immersed the aorta in saline, and it dilated. And he did it again with another one. It dilated. So now suddenly, globally, the race was on. What was the EDRF that Dr. Furchtgott had discovered? Endothelial-derived relaxation factor. It's interesting that 8 years later, Dr. Furchtgott, Dr. Murad, and Dr. Luignaro discovered that the EDRF was a gas. The gas was called nitric oxide. And by 1998, 10 years later, those three gentlemen received the Nobel Prize for the discovery of nitric oxide. And you're saying to yourself, wait a minute, what is it about nitric oxide that makes it valuable for having a Nobel Prize? It's interesting. What are the functions of nitric oxide? One, it keeps all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thick and stiff or inflamed and protect us from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaque. So literally, everybody on the planet Earth who has cardiovascular disease has their disease because by now, in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck. They no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news is this. This is not a malignancy. It is a benign foodborne illness. And once you can get patients to understand that never, ever are they again to pass through their lips a single morsel that is going to further injure an already train-wrecked endothelium, because then the endothelium will recover, make enough nitric oxide so we can halt disease progression. And we often see elements of disease reversal. Now, it's about this time in the presentation that usually if I look out in the audience, I can see them saying to themselves, golly, gee whiz, I wonder what my nitric oxide level is. Well, we don't have a handy way really in the office yet to determine that, but we know that from the research technique, if you take an ultrasound probe and place it over the brachial artery at the level of the elbow, there you get a readout of the diameter of your brachial artery. Then you encircle the upper arm with a blood pressure cuff that is inflated over systolic blood pressure for 5 minutes, so that for 5 minutes there is zero blood flow to your forearm and hand. Yes, I've had that done, and no, it's not habit forming. But after 5 minutes, you release the cuff, and now, once again, with the ultrasound probe, remeasure the new diameter of the brachial artery at the elbow. And in the normal individual, it'll be 30% greater. The next great thing that happened with this was Dr. Robert Vogel, chairman of cardiology at the University of Maryland, took a group of healthy young subjects that were divided in half, and half went to a certain fast food restaurants characterized by arches, which are golden. Half of them had the cornflakes, and their brachial artery tourniquet test was normal. The other half had the hash browns and sausages. Within 120 minutes, bingo, they no longer could dilate their artery. That single meal of hash browns and sausage had so injured, had so compromised their endothelial production of nitric oxide, they could not dilate the artery. However, being young, as they followed them into the late afternoon and early evening, they began to recover. But you and I know that the next morning for breakfast, it'll probably be a scrambled eggs and bacon. Lunchtime, it'll be white bread with cold cuts and mayonnaise. Supper time, it'll be a baked potato with sour cream, ranch dressing on a salad, vegetables soaked in butter, and a lamb chop, and ice cream for dessert. So here in the good old USA, starting as children, we absolutely begin to destroy our endothelial cells. Let's review what we've just learned. Nitric oxide's function: it prevents stickiness, one of the strongest blood vessel dilator, avoids arterial thickening, prevents blockages, prevents smooth muscle migration of muscle into the plaque, and it can destroy the formed cells. Time is going to limit us to discussing of these four wonderful defensive mechanisms. We're going to be discussing the endothelial cell, but I want you to know that the other four defensive mechanisms in our body are all optimized when you are eating whole food, plant-based nutrition. So let's go to where the rubber hits the road. Let's put this to the test. So this was the first small study that I did with patients who had severe coronary artery disease. I was under obligation with my surgical responsibilities. So it was, as I mentioned, a small study. We had nothing against women. And in a subsequent study, there were more, but that is just the way that the patients were sent to me. All right, we want to eliminate all the foods that injure the endothelial production of nitric oxide, all oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a chip, oil in a salad dressing. Oil is a killer. I wrote a paper published in the International Journal of Disease Reversal and Prevention, and the title of my article was, Is Oil Healthy? And I discussed the animal studies and the human studies, how oil injures endothelial cells. And we want to eliminate animal protein, meat, fish, chicken, fowl, turkey, and eggs. Also, we want to eliminate dairy, milk, cream, butter, cheese, ice cream, and yogurt. And I don't like caffeinated coffee. And I'm very cautious about nuts, peanut butter, nut butters, cashew sauce, and avocado. Now, just because some of you are probably going to be a little nervous of what I just said about oil, here is another peer-reviewed scientific article showing that olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Now, this is the work of Stanley Hazen at the Cleveland Clinic Research in Cardiovascular Disease Department. He was looking at, first of all, omnivores who eat really a whole variety of animal foods, and they possess lecithin and carnitine. And what he found was that persons who are omnivores possess in their gut bacteria that are capable of metabolizing lecithin and carnitine into TMA, trimethylamine, which is rapidly oxidized in your liver to trimethylamine oxidase. Trimethylamine oxide happens to be very detrimental to your vascular structures. So what was really rather fascinating was that when Stanley Hazen took only patients who were totally plant-based, fed them a lamb chop, and then tried to find TMAO, not there. Persons who are totally committed to eating whole food plant-based nutrition do not possess in their gut bacteria that are capable of converting lecithin and carnitine to TMAO. Another powerful reason to eat plant-based. For one slide today, we are departing from cardiovascular disease because this, I thought, was a very momentous moment in nutrition history when the entire members of the WHO, the World Health Organization, in October of 2015, agreed that red meat and processed meat had the same level of carcinogenicity as smoking cigarettes. Pretty profound and pretty powerful. All right, so what are you going to eat? You're going to eat all these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, and some fruit. I want to share with you that about a decade ago, I made a fairly significant change. And that change was motivated by a recognition of the fact that the endothelial production of nitric oxide is age dependent. For instance, you never heard of a boy or a girl at age 8 having a heart attack. They have nitric oxide coming out of their ears. But by the time they're age 50, beautifully healthy, they now have 50% of the nitric oxide they had when they were age 25. And by the time you're 80, you've lost 70%. So the two changes I made were, one, a greater stimulation of the endothelial production of nitric oxide. And number two, I embraced the newer research that shows us that mankind has an alternate pathway for making additional nitric oxide. For a heart patient, I need them to chew, not smoothies, not juicing. I need them to chew 6 times a day a green leafy vegetable that is approximately the size of 1/4 of their fist after it has first been steamed or boiled 5.5 to 6 minutes, so it's now nice and tender. Then you must anoint it with several drops of either a delightful balsamic or rice vinegar. Why? Because research has shown us that the acetic acids from these vinegars can restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So You're going to chew this alongside your breakfast cereal, again as a mid-morning snack, and again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. The second benefit that comes from chewing the green leafy vegetable restores the capacity of your bone marrow to once again make the endothelial progenitor cell, which will replace our senescent, injured, worn-out endothelial cells. The third benefit from chewing the green leafy vegetable, when you're chewing the green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the anaerobic bacteria in your mouth. When mixing with the nitrate, will reduce the nitrate to nitrite. Now, when you swallow the nitrite, it is your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. What you're doing for minimal expense and no side effects, literally all day long, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there's a caveat here, and that is that toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids. Why? Because antacids will lower your gastric acidity, and you will be unable to reduce the nitrite to more nitric oxide. Now, the top 6 vegetables would be kale, Swiss chard, spinach, arugula, beet greens, and beets. If you want to have the whole list, it goes like this: bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, apple, cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus. And the reason I go through this with you like this is you have to know how whole food plant-based nutrition can do wonders for your memory. With apologies to Leonardo da Vinci, no oil! Going back to this original group, at measuring their lipids at 5 years and at 12 years, you can see their cholesterol total was under 150. Their LDL was averaging around 80. And I want to share with you now several angiograms of disease reversal. And these angiograms were all reviewed in triplicate in the Cleveland Clinic Angiography Core Laboratory by senior technicians that do this all day long for national medical trials. So when I give you a percentage, I know it's accurate. This is the left anterior descending coronary artery in a 67-year-old retired pediatrician. From the arrow on the left to the arrow on the right was described as a 10% improvement. That's about as small as your naked eye can see. On the other hand, a little easier in this 58-year-old factory worker looking at the circumflex artery to the back of the heart. From the arrow on the left to the arrow on the right was measured as a 20% improvement. Here we see the right coronary artery in a 54-year-old security guard, and from the arrow on the left to the arrow on the right was described as a 30% improvement. This next one is Joe Crow. Joe Crow at age 44 in 1996, with a cholesterol of 156, began getting chest pain. He was not a smoker. He was not diabetic. He did not have high blood pressure, no family history. He regularly exercised. So finally, in October of 1996, cardiology did a workup, but they could find nothing. A month later, he finished his surgical schedule and sat down to write postoperative orders when suddenly the elephant was sitting on his chest. Pain in his left jaw, left shoulder, left arm. He was whipped down to the cath lab. He was having a heart attack. He had a cardiac arrest. They resuscitated him. Finished the catheterization, one more cardiac arrest. Then he was sent up to the floors. He stabilized and was discharged several days later. But he was very depressed. And the reason he was depressed was at the time of his angiogram, this is the left anterior descending coronary artery, you can see that the entire lower 1/3 of the artery inside that yellow bracket was all moth-eaten and diseased over too long a segment. You just can't hammer in a stent. And it was too far down the artery for bypass. So he felt there was nothing that they could do for him. So Ann and I had Joe and his wife out for supper 2 weeks after his heart attack. Joe, come on. You've been eating the typical Western diet. You got the typical Western disease. We've had 10 years of experience with this. Why don't you think about switching to whole food plant-based nutrition? And he said, okay, I'll give it a shot. They couldn't offer me anything else, but I'm not going to take any of those statin drugs. I don't trust them. Fine. Not a problem. Your call. He became the absolute personification of commitment to whole food plant-based nutrition. His total cholesterol plummeted. His LDL went from 98 down to 38. And 2.5 years after his first angiogram and heart attack. He had another angiogram. His office and my office are only three doors apart. At noontime, on the day that I knew earlier that morning he had his follow-up angiogram, I walked over and knocked on his door, went in. There he was, sitting behind the desk. Joe, I understand you had your follow-up angiogram earlier today. Mind sharing with me, how did things go? He got up from his desk, came around, put his arms around me and said, I think we're doing okay. I said, well, would there be a chance that I could see the follow-up angiogram? He said, sure. And you can see that was really quite exciting. We had almost a total complete reversal of that plaque in the artery. It's interesting that when the patient is young and when the plaque is young, the body and the patient really commits to whole food, plant-based nutrition. The body can do a marvelous job when the plaque is made up of inflammation, fat, and cholesterol. But in the older plaque that's been there for decades, it's made up of fibrosis and scar and calcification. It may be more stubborn, but even those patients, interesting enough, can get back to full activity of daily living without restriction. And I'm going to show you how that happens as we move along here today. I wanted to know, in the 18 patients that stayed with us beyond 12 years, I wanted to know, in the 8 years prior to coming into our study, while they were in the hands of expert cardiologists, these 18 patients had these elements of disease progression, worsening disease, defined into various categories for a total of 49 events in that 8-year period. However, once they came into our study, after 12 years, 17 of those patients had no further events except for one little sheep who wandered from the flock, got into the wrong foods, had to have bypass, but he's now back with the flock and proves the point that I'm trying to make with you today. However, as elated and excited as I was that we could show such dramatic reversal, not everybody was convinced, obviously. Dr. Esselstyn, that's a small study. Dr. Esselstyn, it was not randomized. Dr. Esselstyn, what makes you think you could do a larger study and get similar results? So we did. And this time it was 200 patients. 2 were lost to follow-up, which left us with 198 patients, of whom 177, or 89.3%, followed our program. 21 patients did not. A number of physicians have read our papers and agree that what we have accomplished, but they say they can't get their patients to make the change. A couple of points about that, because it's absolutely key. If you are going to ask a patient to make a lifestyle change, you've got to show a patient respect. The only way to show a patient respect is to give them our time. So in the present format, when patients call in and want to see me for counseling, I do this collectively once a month. It's a 5-hour program, and every one of those patients, my secretary will have given me their contact information and their phone call. And before they ever come to the seminar, I personally insist on calling them for 40 to 45 minutes so I can get my arms around their story. And at the same time, give them an opportunity to ask questions so that coming to the seminar, we have a strong platform from which we can all move forward. It's also fascinating that there were 27 patients in that group who were told before they ever saw us that they had to have an intervention of a stent or bypass, but once they followed whole food plant-based nutrition, that was not necessary. Interestingly enough, of the 177 patients who followed the program, there was one patient who had disease progression. He had a small stroke, but in essence, he really should not have been in that group, because when he was in China on vacation, completely abandoned everything he had learned about whole food plant-based nutrition and had a small stroke from which he recovered. But since he had strayed, he should not have been in that group. And everybody who actually adhered to the program had no further events. The 21 patients that did not adhere, 62% had disease progression. So it's pretty powerful how this ties together. What I wanted to do for further evaluation was take some of the better known cardiovascular studies and see what their rate of major coronary events was and compare them to ours. So what you're seeing here on the far right is the Lyon Diet Heart Study. And at the end of 4 years, 25% of the patients in that study had a major cardiac event of heart attack, stroke, or death. So let's go one to the left. This time, we're looking at the natural history of disease from Columbia Presbyterian Hospital in New York City. 20% heart attack, stroke, and death at the end of 4 years. Go to the left. Now we have Bill Bowden. And at the end of 4 years, 19.4% in his Courage study had heart attack, stroke, or death. Now I go to the left. Here we are, 0.6%. That is a 30-fold difference. Why are our results so different from standard cardiology? The answer: we are discussing with the patients the causation of the illness. We want every one of our patients to fully grasp and understand that they created their disease by eating in a way that destroyed the endothelial capacity to make nitric oxide. When they ran out of nitric oxide, they ran out of protection. Pretty powerful. And we really think that the day ought to come when really everybody with cardiovascular disease should be offered the opportunity to halt and reverse their disease, because none of the drugs, none of the stents, none of the bypasses has one single solitary thing whatsoever to do with the causation of the illness. And when you think about it, this is really a dark eye in the medical profession, to think that we have known, literally, for many, many decades, we have known that there are multiple cultures on the planet Earth where cardiovascular disease is virtually non-existent. But what have we done to bring that simple, straightforward, safe, inexpensive information and bring it to this country? Almost shameful. The thing that's really excited, the patients are really empowered once they understand this, and they're elated to think that we are actually empowering them as the locus of control to halt and to reverse their disease. Now, how about this? On the left, you see the pulse volume at the ankle of a 54-year-old gentleman with heart disease who had to, when he crossed the skyway to my office, he had to stop 5 times because of pain in his right calf muscle because of this partially blocked vessel in his thigh. Well, I sort of forgot about his leg and was so fascinated with his heart disease. 10 months into the program, he said to me one day, "Dr. Esselstyn, you recall when I first started seeing you, I was stopping when I crossed the skyway to your office 5 times because of pain in my calf." I said, "Yes." He said, "The last month, it's gone. I don't have the pain anymore." I said, "Don, back you go to the vascular lab. And now you look on the right. Bingo. Suddenly, the pulse volume is doubled. And we now had absolutely rock solid, irrefutable science that food and food alone could reverse heart disease." And somebody's going to say, "Well, wait a minute. What about the statin drugs?" Well, this is the second patient I've shown you today that had dramatic reversal of their disease, because the statin drugs here weren't even around in 1986 when we were treating this patient. Now, on the other hand, what we have here is another situation. This was a high school chemistry teacher, age 78, who in his retirement loved to and be involved in square dance contests. But it was during the fast square dance that he was getting bilateral calf muscle pain. And he saw several vascular surgeons who got the images that you see here, but he did not like the rather large operation that they proposed for him. He came to see us and asked us, said, "Dr. Esselstyn, if I choose your method, how long will it take me to get rid of my calf pain?" So I looked at him with great wisdom in my face and said, "Probably about 9 or 10 months. And 3 months later, I got a phone call. "Dr. Esselstyn, you do not speak the truth. The pain is gone." Now, I don't know in Hawaii whether you have the same advertisement that we have here in Cleveland when you're watching a sports show or you're watching a mystery. Just before the advertisement comes on, you will hear the mellifluous tones of the announcer say something like, "When the moment is right, will you be ready?" Now, we all know that the penile artery is much smaller than the coronary artery, and not infrequently, before somebody comes down with heart disease, they may notice they're unable to raise the flag. However, all is not lost. Not infrequently, 10 or 11 months after I've counseled somebody, I'll get a phone call. "Dr. Esselstyn, yes, this is Mr. So-and-so." "Sure enough." "Yeah, Doc, I really thought I ought to give you a call because recently something has come up, and I'm wondering if I don't owe you another check." I promised we would talk about when there's plaque that doesn't go away, how do these patients kind of reverse their disease? What you are looking at here, especially on the left, is a PET scan. And when the PET scan shows that it is orange or yellow, that is good perfusion with blood. But as you can see on the left, there's a patch that is green, which we call ischemic. That is, it's very poorly supplied with blood. This was in a 60-year-old downtown Cleveland stockbroker who, when I first saw him, had a cholesterol of 248. 10 days later, after counseling him, his cholesterol was 137. 3 weeks later, we got another PET scan, and the area that was green, as you can see, now is all reperfused. How does that happen? You don't wash out a plaque in 3 weeks. What I want you to understand is this is the blood supply to the heart. You can see the three major blood vessels that ride on the surface of the heart: the right coronary artery, the left anterior descending, and the circumflex. Where do they go? Well, all the publicity about stents and bypasses has to do with operating on those large vessels that are on the surface of the heart, but they all eventually dive into the heart muscle, where they separate into these smaller vessels, interconnecting thousands and thousands of interconnecting small arteries. At this point, I contacted Rodriguez, who is the chairman of cardiovascular pathology, who perhaps dissects 200 hearts a year. And I asked Rodriguez, I said, how often do you ever see any plaque or blockage in the artery once it has dived into the heart muscle? His answer, never. Now I knew I had the answer, because what is happening is this. When I first see these heart patients who are eating this horrible Western diet, they barely have enough endothelial material to make any kind of nitric oxide, which is the great blood vessel dilator. And at the same time, the endothelial cells have been so beaten up, they are now your enemy, because they are now producing two molecules, endothelin and thromboxane, which are vasoconstrictors. They cause all those thousands and thousands of interconnecting little intramuscular arteries are now pinched and narrowed. No, they do not have blockage or plaque in them, but they are narrow because their diameter from the squeezing of endothelin and thromboxane. So what's so exciting about treating these patients, when they immediately, completely 100% stop any food that is going to further injure endothelial cells, what does seem to happen is that the endothelial cells stop making endothelin and thromboxane, which are the vasoconstrictors, and it starts making, like, once again, nitric oxide, the vasodilator, which is so gratifying when you treat these patients, because often within 4, 6, 8, or 10 days, their angina or chest pain is markedly improved, or it may be back to normal. So let's review disease reversal. We've seen it with an angiogram. We've reversed it in stress test. We've talked about reversing with PET scan. Also, we've seen it with the arteries that go to the neck, the carotids. Well, on ultrasound, you can show the reversal. I've shown reversal of pulse volume. And we talked about the reversal of the symptoms of angina, claudication, erectile dysfunction, and also not listed here also is EF, the ejection fraction. That is to say, the capacity and the strength of the heart to squeeze. For example, 50%, anything over 50% is normal. When you get down around 45, 40, and 35, now this is what you see in heart failure. There's one thing that I've learned over the years. Yes, brains are certainly important, but nothing is important as persistence, best exemplified by this young damsel in Life magazine in 1939, trying to learn how to do the splits, but she stuck with it. And sure enough, the other day, I think it was in Honolulu, that somebody spotted her and she had got it right. I wanted to say I'd be delighted to answer any questions.
Is drinking a fruit with veggie smoothie good or bad for you, in particular for people with elevated lipid levels, and why or why not?
Well, what you get when you take a smoothie often is you're just getting so much sugar. I don't have a problem with somebody eating an apple, an orange, or a banana. But let's suppose that you fill up your blender with green leafy vegetables, blend it up, and then try to eat it. It's a little bit too tart. So people want to sweeten it up. And now they put in an apple, orange, and a banana, beat that up. Now what you see, when you're eating the fruit as fruit, the fructose is bound to fiber, and the absorption is safe and slow. But once you beat it up in the blender, now you separated the fructose from the fiber, and the sugar and the fructose goes off in your stomach like a rocket, injures in liver, endothelial cells, and so forth. So it's not a good plan.
For people who follow your plan and have elevated lipid levels, cholesterol, LDL, your preference is having cholesterol checked often, 3 to 4 times in the first 2 months. Is this a problem for, if you want it to be covered, the cost to be covered by medical insurance?
When I wrote the book, that was in 2007, we were really anxious that patients should be on top of this. I think what we've learned since then is if you get your lipids taken once or twice a year, if, let's suppose, you're following the program 100%, all right? If I had 1,000 people who follow our program 100%, there would be some who will have a total cholesterol of 102, Some will be 140, 160, 180, 200, 220. Everybody has a different thermostat in their liver to manufacture cholesterol, what their needs will be. But what seems to be most important of all, let's suppose that somebody cannot take a statin and they follow the program 100% and their cholesterol doesn't go beyond 190 or 200. We found out years ago that when those patients are following it correctly, it is such an anti-inflammatory diet that you are building yourself an endothelial fortress. As you build yourself this endothelial fortress, even if you have a few extra molecules of LDL cholesterol, ApoB cholesterol, or LP small a, all of which are sort of different forms of cholesterol, you're going to be fine. And how can you measure this for sure? You can do some blood tests, which are biomarkers, to determine that your inflammation is well under control. What are those tests? Oxidized LDL, asymmetric dimethylarginine, myeloperoxidase, trimethylamine oxide, and highly sensitive C-reactive protein. Those 5 tests. So if you're got no inflammation, and even your cholesterol is not in and of itself evil. Every single cell in our bodies is made up of, the cell membrane is made of cholesterol. It's essential. So in other words, don't go off the deep end if your cholesterol remains high. If you're following the program exactly as designed, and also your inflammation indices are nice and low.
Dr. Esselstyn, I wondered what you think of the Ornish diet. We do have that here in Hawaii. We even have a clinic. I'm associated with the hospital system here, and I know that our local insurer, HMSA, which is a Blue Cross Blue Shield, does cover that. So is there any difference between the Ornish diet and what you suggest?
They're very subtle. No, I've been a friend of Dean's for years, and what happened was we both sort of discovered it on the same time. But since Dean has been using meditation and relaxation techniques, we felt that not everybody was fully compliant or embraced that concept of it. We have never included that as our program. And we found that for some people, it simply simplifies it more. I think that's the best I can share with you. So we're very happy to say that from a scientific standpoint. And as a matter of fact, I've just now personally counseling going back to 2009, some 1,586 patients that we really have to look up again. The most recent study we did of our patients was of those 200 patients that I shared with you today. And it was really very exciting and very gratifying from 2 standpoints. One, 90% of those that we counseled continued to follow this up close to 4 years, 90%. And at the same time, every one of those 177 who followed the program halted any disease progression.
From what you're saying, I feel like we're at the same place where we were with cigarettes when the Surgeon General had to put out the warning and label cigarettes. When are we going to start labeling meat and also saying it in restaurants even, that, meat can be, dangerous to your heart? Or I don't know how you would say it, but I think we're at that place where we have to start labeling it. What would you say?
Well, I think that would be, I'm afraid, I'm all for it, but I'm afraid that there would be a fair amount of resistance.
As there was with cigarettes, but nevertheless, one out.
Well, my hope would be that if, as you probably have ascertained, that as much as I respect my cardiovascular colleagues, to me, it's really absolutely shameful when we know perfectly well what is so safe and so simple. Mm-hmm. If you get these patients to so suddenly throughout this country, everybody in cardiovascular medicine understood and was willing to embrace whole food plant-based nutrition. The word would be out in a flash, and suddenly restaurants would have to change because people would not want to go there to eat those foods. But it's just incredible the resistance, and part of it. And all I often hesitate to say this, but what do you suppose the remuneration is, or what is the foundation for most hospitals right now? It's the treatment of heart disease. What do you get for doing a big operation on the heart bypass? Huge. What do you get for doing a stent? Money. What do you get for talking to a patient about Brussels sprouts and broccoli?
You get a long life.
Yeah.
Yeah, and they thank you.
Do I have to get your book to know what the portion control is? What are the portions eating the foods that are good for you? Or does it matter? I mean, how many portions of beans can you eat, and fruits and leafy greens and that sort of thing, or does it matter?
Well, actually, I think the only way to really answer this truthfully is to say, eat with common sense.
Okay. Fair enough.
In terms of your portion, you're not going to eat enough so you feel stuffed. And, your body's going to love you if you eat a modest amount, especially of the right foods. If you get hungry several hours later, go for a snack, but make sure you know that it's correct food.
I had a question on the greens you had recommended, like spinach, Swiss chard, and beet greens, which are extremely high on oxalic acid and which binds to your iron and calcium.
Right.
And let's see, is that an issue for?
Yeah, doesn't seem to have been, but if somebody has been a recurrent former of calcium oxalate stones and so forth, then again, go to the internet and look up, and you'll find those that are low in oxalate, and that seems to be a nice alternative.
Okay, but the oxalate, they say it binds to your iron and calcium. So, should you just kind of be more diversified in your greens rather than just eating?
I tried to share when I was speaking about the memory. I gave you a list of what a food. Yeah, I gave you the top 6, and then I went through, bok choy, Swiss chard, kale, collard green, beet greens, mustard green, and so forth. So the variety is terrific, because when you do that, you're getting this whole range of different phytonutrients from each different green. You didn't hear me say eat only one different type of green. I said I gave you a variety.
Well, you did recommend those 3, but low iron, is that an issue for?
No.
Having low iron. Oh, okay. Thank you.
Sure.
I would like to know if it's okay to have a fluoride toothpaste at bedtime when you will not be eating anything for the next 10 hours.
Well, I've tipped my hat on this to Nathan Bryan, who was the researcher at the University of Texas that did all the basic work for this. And it seems to be that fluoride is somewhat problematic with the body's attempt to make nitric oxide. Mm-hmm. So that's why we suggest that we avoid it. Now, that is in conflict with the dentist, but if you're brushing your teeth twice a day and flossing, you should be able to keep this at a minimum.
All right. Thank you.
Sure.
What's in your opinion, the best organization to give money to promote vegan eating?
Well, I think probably the place to start, since you're in Hawaii, and I'm speaking to the Hawaiian Vegan Society, that would seem to me that you'd keep your dollars at home, and they'd be helping you and all your friends.
Okay, thank you for that answer. That's a good answer.
Hi, so my question, actually, I've been vegan for the past 35 years, and I've noticed a big change in the amount of vegans that have come along in the last few decades, especially with the millennials now and the Gen Z with climate change. I think that's kind of a bigger push than health and environment and animal welfare has been. But anyway, my question has to do, I'm a microbiologist and an epidemiologist, and I have been looking at the relation of TMAO to disease, mainly diabetes, heart disease, and some other inflammatory diseases. And I'm wondering if there is an easy way to get tested for TMAO levels.
I'm mostly familiar with that through the work of Stanley Hazen at our institute.
From Cleveland Clinic, yeah.
Yeah, exactly. And I think you'd probably have to go to wherever your doctor sends you for your lipids and your blood work, you might see if that laboratory is also doing TMAO analysis.
Yeah, I've asked that, and they said they have to send it out to the mainland, but it isn't something that's been part of the regular panel. Both my parents live here and are in their 80s, and my mother had diabetes diagnosed a few years ago, so I brought her to the Ekahi Ornish programs, but because they were full, she couldn't enter, so I had her do the plant-based diet following your book and recommendations, and now she's been diabetes-free for about 5 years. And she went and had a stent surgery done with a doctor, a TAVR surgery, with the doctor at Straub. And he was actually looking at cohorts of plant-based people and regular patients. And all of the patients that followed the plant-based haven't had any complications and have been doing very well the past 3 years since she's had it done. So it looks like a lot of cardiologists are interested in that, but there wasn't a particular test he knew of to look at TMAO, but he was familiar with the compound and the implications for atherosclerosis. So I was kind of curious of my father, who has atherosclerosis, if he could get tested somehow, but I haven't been able to figure out an easy lab to have anything sent. And I kind of feel like if people were aware of it, that might help them know.
I think you're doing wonderfully, but remember, how often do you suppose the people in rural China or the Papua Highlands in New Guinea or Okinawa, how often do they get their TMAO tested?
Yeah, it was more for people on the SAD diet to convince them that this was something they had to worry about, like some sort of indicator. You can tell them to eat like people in rural China, but if they don't think that the SAD diet is a problem without a marker, it's a little hard to convince them.
They get feedback that their labs are going in the right direction. That's a much more powerful.
Yeah, I did a project with the Cancer Center here, and they looked at 14 different species of gut bacteria that were found to contain the enzyme to cleave that TMA molecule off of choline, carnitine, and different compounds. And so it was sort of like, okay, if we could use TMAO as a blood marker to show them that they might have those bacteria present, that by changing their diet to more leafy greens and things that won't support the harmful bacteria and actually support better bacteria, that would be sort of a way to get people to make that switch. It's just right now, it's very difficult for me to convince my father to not eat.
Oh, I think the thing that I feel in our presentation, the thing that really sort of catches their ear is if I spend enough time having them embrace and understand the fact that they themselves have created this disease by destroying their endothelial capacity to make nitric oxide, which is their great protector. They're nitric oxide deficient. And when they get that right and understand that because I told you I was mean, I don't want them ever again to pass through their lips a single morsel that is going to further adversely impact our endothelial production of nitric oxide, because it more or less, it really empowers them as the locus of control to be in charge of restoring their health and getting rid of this vascular disease.
Is there any connection to this with AFib?
That's a wonderful question. Atrial fibrillation is the most frequent cardiac arrhythmia. And I wish I could tell you that whole food, plant-based nutrition would reverse atrial fibrillation, but I don't know of any hard data that would indicate that. Although, yes, there have been patients who have told me that once they started this diet, that their atrial fibrillation, which they'd had for years, was under control now. But that is totally, I'm not going to say that, although I'm certainly in favor of somebody with atrial fibrillation who wants to do this because it'll help so many other things. But it would be totally unfair, I think, from a scientific standpoint, for me to tell you that atrial fibrillation would be resolved with whole food plant-based nutrition. I would rather, there are some newer techniques with ablation that are safe and powerfully effective, because I hate atrial fibrillation for patients. It's just not a way to go. a good ablation. Somebody who has done this hundreds of times, so they have a skill for it. Yeah. Too much saturated fat in the avocado.
Any recommendations for omega-3 and collagen supplements?
I don't use collagen supplements. Omega-3, if you want to use flaxseed meal or chia seeds, I think regular on your cereal, and you're eating plenty of green leafy vegetables, as I indicated, you're probably going to have a normal amount of omega-3. You're never going to have to worry about omega-6. You're going to get plenty of that. But you can, if you want, you can check your omega-3. It'll either be optimal, borderline, or low. And if it is borderline or low, and you can get the omega-3 algae as a supplement to see if you can boost it.
I just wanted to say thank you. I am a 48-year-old female, and I have 5 heart stents, 4 of which I received last September, and my hospital had the Ornish program. So I went to the cardiac, and I have been eating the whole food plant-based. And because I had like a 1% chance of some scar tissue, 6 months later, they had to go back in to give me my 5th stent. So I just wanted to say within 6 months, I had 2 40% blockages. And because they had to go back in and look, they went to 30% just in that time from eating whole food plant-based. So I love the Ornish program, Dr. Esselstyn, and all of, I have all the cookbooks, I watch the videos, and, it works. So I just want to encourage anyone with that.
Thank you so much.
Thank you.
Yeah, doctor, my cholesterol has been pushing 270, 280 most of my life. My right cardio, whatever, to my brain is fully occluded. I suffered a stroke about 5 years ago. I've been to 4 doctors. They all want to give me a bypass. I went and saw Dr. Najun Dapa at Cleveland, and he introduced me to your methods. And immediately, my cholesterol has now been hanging about 107. But my question to you is this. I get in a hurry oftentimes for lunch. And what about a bowl of Cheerios or some rice checks with some oat milk?
No,
is that okay?
No, read the label. Those are just awful cereals.
Oh, okay.
Yeah, you want to add shredded wheat or old-fashioned Quaker oats, that's fine.
Oh, okay.
Well, and
what
also,
about,
I think you'd be congratulated for pronouncing the doctor's name. He's a friend of mine, and I can't pronounce it.
Yeah, he tells everybody to call him Dr. Dapa.
That's it.
Yeah. What about like things like Trident gum? Is it okay to chew gum?
You don't want a lot of sugar on it. That's all.
Yeah, it's sugar-free, so they say.
Sounds like it.
Sounds okay. Yeah.
Sounds okay.
Okay. Yeah. Okay. Great. All right. Thank you, doctor. Thank you for many things. Yes.
You're welcome.
I'm so happy that you spent this time with us today, Dr. Esselstyn, and also Ann Esselstyn. Thanks to the both of you for being here. Aloha and mahalo